Hi, this is Tyler Muffley bringing you urogynecology tips from my kitchen table. Today I wanted to talk about pelvic organ prolapse treatments. Seeking medical attention to see a gynecologist, urologist, urogynecologist doesn't necessarily mean that you have to have surgery right away. And a lot of times women start with more conservative therapies like pelvic floor physical therapy and go on to surgery only if their symptoms worsen. When considering your treatment options, it's best to have to work with your urogynecologist to make a plan that works best for you. A lot depends on your individual problems and your individual preferences about how to take care of problems. First option is to do watchful waiting. Not all prolapse requires treatment, and the goals of treatment are really to improve your quality of life. So if the prolapse isn't causing you any discomfort, or it's not rubbing on your underclothes or interfering with things that you enjoy, your urogynecologist may not recommend that you do anything at this point, and just kind of watch and wait and see how it goes. Next option would be behavioral treatments. Oftentimes we talk about diet and fitness when we talk to patients about this. Some modest weight loss of about 10% can lead to significant improvements in pelvic organ prolapse and urinary incontinence. Also, managing fluid intake. You don't want to drink your body weight in water each day. We really recommend that people drink when they're thirsty. The common thought is that drinking water is great for me and I should drink more water, but oftentimes that can overwhelm the bladder, and really there's no scientific data behind that. Next, adjust your physical activity. We know that people who do more physical activity have more regular bowel movements, and being active also helps maintain a normal body weight and decreases your risk for urinary incontinence. However, high-intensity exercises, sometimes like CrossFit, can put pressure on your pelvic floor and increase your risk for urinary incontinence in the future. And lastly, if you smoke, we recommend that you quit now. So what is pelvic floor physical therapy? Pelvic floor physical therapy is like going to the gym for your vagina. It's one-on-one with you and a female pelvic floor physical therapist, where you'll chat with the physical therapist about what your goals are and what your expectations are, and then she'll work with you to help meet some of those goals and expectations. An initial evaluation often includes checking your muscle strength, assessing your pelvic floor coordination, and sometimes some other testing. Based on the findings of this exam, the physical therapist will create a plan for the two of you. Part of pelvic floor physical therapy includes Kegel exercises, like you've probably done in the past, and this can help strengthen that bowl of muscles that holds up the bladder and the urethra and the rectum, and it's called the levator ani, or the pelvic floor, and this can help also give you better control of your bladder function. About 60% of the time, women are not squeezing in the right location. They're squeezing in their bottom or their legs, and so during the exam we try and test for this, and then have the patient work with a female pelvic floor physical therapist to strengthen and coordinate their muscles in the right way. Kegels are not the only thing there is for pelvic floor PT, though. Biofeedback can be very helpful, and you can see on a screen how well you're squeezing, and it can help you squeeze the correct muscles, and either you'll see it on a screen or hear a tone, and this message or feedback can help you improve and give you awareness of pelvic floor muscles. Another form of pelvic floor biofeedback is vaginal weight training. This is like Kegels on steroids. And there's cone-shaped weights that go inside the vagina, and you place them inside the vagina and squeeze and hold them in place while you're doing day-to-day activities. Usually we have patients keep them in place for a short period of time, 15 to 30 minutes at a time, and by gripping or hugging these cones you can strengthen those pelvic floor muscles even more. Vaginal cones or vaginal weights can be used at home and are a nice tool to have in our armamentarium. Okay, the next tool that we wanted to talk about that's not surgery for pelvic organ prolapse is called a pessary. A pessary sort of looks like a diaphragm, if you ever have seen one of those or used one in the past, and it's a device that's inserted into the vagina to push on the urethra and provide support. And a pessary is made out of medical grade plastic, and it folds and can be inserted inside the vagina, and it's a low risk option. Just like a diaphragm, it's fit in the office, and Oftentimes we need to try 1, 2, sometimes 3, 4 different sizes and shapes. You weren't a real urogynecologist in the 19th century if you didn't have one of these named after you, so there's quite an array. This is a low-risk option for people who have pelvic organ prolapse or symptomatic urinary incontinence. Pessaries do require some ongoing care to make sure that they're not cause a problem with vaginal infection or rubbing of the pessary against the vagina causing ulceration, infection, or bleeding. Unfortunately, we see patients every year who have had a neglected pessary where it's grown inside the vagina and it can rub into the bladder or into the rectum and cause major problems. Unfortunately, not all women are great candidates for a pessary. Women who have scarring, shortened vagina, or very weak pelvic floor muscles might not be able to hold a pessary in place. But typically, incontinence pessary users are women who might need a temporary boost of their urethral support during exercise. They might have mild symptoms and want to avoid surgery. They might have health problems that prevent them from being an excellent surgical candidate. And there are people who are willing to invest the time to remove the pessary, wash it, clean it, put it back in, and take it out on a regular basis. Alright, this is Tyler Muffley bringing you urogynecology tips from my kitchen table. Thanks so much.